Ladies and gentlemen, this is your mental health clinic. My name is Major Anya Fedotova, and I'm a mental health flight commander at Los Angeles Air Force Base.
I'm Major Nick Sari, also with the Mental Health Clinic at LA Air Force Base, and we're here to talk to you about effective coping strategies during the COVID-19 or coronavirus outbreak that you can also utilize in any other day whenever you feel stressed.
There is a lot of information about coronavirus, and there is also a lot of misinformation about coronavirus. First thing we ask you to do is take a deep breath. Majority of people who even do contract coronavirus experience no symptoms at all, or the symptoms are very, very mild. So we really need to be worried about those who are immunocompromised or elderly, maybe children. But do remember and keep in mind that there are measures that are being taken to protect those populations.
And then get the facts. There's so much information out there, whether it's on social media, on the news networks, and it may not all be accurate. So really the best resources are the Centers for Disease Control and the World Health Organization. They usually have frequent updates, live updates, and the most up-to-date and accurate information. You can even break it down to your specific location, your county, your town, and that is really one way to stay up to date, but also reduce the anxiety about it to make sure that you are getting accurate information and not anything that's just simply opinion.
So CDC, World Health Organization, American Psychological Associations would be credible sources. Use them and do limit your use of social media if you can. Speaking of which, if you find yourself in a situation where you have to stay at home with your kids because maybe the school is closed or their care center are closed, please keep in mind that kids will emulate your behavior. If you act in anxious ways and you constantly check your social media, your kids are most likely will be feeling that anxiety, may start acting fearful or anxious, and you want to prevent that. You do want to communicate with your kids in honest ways. You don't want to explain everything to them, but in a way that is age appropriate. So use age appropriate language to talk to your kids and reduce the anxiety. Do remember you want to stick with routines. Nobody likes disruption in routines. We want to keep the same schedule, and if you're able to create that for your kids, do that.
Additionally, if you're at home with the kids, you might also want to stay connected to adults. So the way you do that, if you avoid social media, is do it the old school way and pick up the phone, contact a friend or a family member, check in on them, see how they're doing, and you might be surprised. They might also ask you how you're doing. So it is important to maintain those social connections, even through social distancing, as we're urged to do, and stay 6 feet away from each other. We're not doing that so well.
Bad example of that.
But do stay away from crowded places, but at the same time, don't let that prevent you from picking up the phone and contacting someone to maintain that emotional connection and that source of support.
And should you find yourself in isolation or quarantine, do keep in mind that some of you may experience more severe symptoms such as fear, anxiety, insomnia, maybe significant irritability. And do know that some of these reactions are not unexpected. If you find yourself unable to cope with them, seek professional help. And the first thing we want to encourage you is to seek professional help via telemental health or picking up the phone and calling a Military One source, which is operational and works 24/7, or crisis line. And you can simply Google crisis line, press option 1. It's a great resource. Somebody's available there 24/7. So there are resources available to you if you are in those dire circumstances.
So I think we're off to a good start in effectively coping with the coronavirus, and that's all I got.
Yeah.